All right, welcome back.
Thank you.
Really interesting sharing session earlier. So now we're going to dive into the Q&A. Thanks, welcome back everybody. So I think, I hope everyone, we have about 20 participants now. So we're gonna maybe just give it a couple more minutes for people to just jump onto the webinar before we start. Yep, so just in case I've not introduced myself earlier, I'm Nurfilzah and I'm from UNDP Global Center Singapore. I manage communications and I'm going to be moderating the Q&A today. So for everyone that's already online, just put in your questions either in the Q&A function or in the chat function, whichever that's easier for you. And I also do have a few questions. Sorry, I have a few questions on my own, just to keep the ball rolling. Okay, so I think we'll start because I think we're a bit pressed for time. But if we need to overrun a little bit, you know, if everyone is okay with that, then we'll just keep the conversation going. Okay, so I understand that we have on the call we have Ann from Sweden, Arild from Norway, Marko from Finland, Ingi from Iceland, and Chee from Singapore. And you guys probably heard a little bit from them earlier, just brief overviews of what they're doing in their respective countries to tackle COVID-19 in detection, in prevention, in government communications, and so on. So before I start with my own questions, all the participants who are online right now, just to let me know if you have any questions, if you can type them out right now. I have an eye on the screen. And if not, then I will start with my own questions. Nothing, no. Okay, great. Okay, oh wait, okay, question coming in. All right, so thanks for that question. Can we also mention in each question who the question is directed to, please? Okay, maybe I'll just answer, this question can just go out to the whole panel, and whoever that would like to answer it, just please go ahead. So we have a question here from the crowd. Could we use this crisis to eradicate the use of usernames and passwords, meaning go away from current identity platforms and using an SSIO, self-sovereign identity? So any of our panelists would like to field that question, please?
I can talk a little bit about that. Here in Iceland, we have this national electronic identification. So we can actually allow people to log on to any solution in Iceland with the same ID, and it's stored in a SIM card on our phones. So it's quite easy, both if you're using your phone for browsing or things like that, or if you're going online on your computer, it's quite easy. So.
Okay, fantastic. And I do know we also have something similar in Singapore with our SingPass. Chee, would you like to add on to that as well?
Well, I'm not sure maybe where the question is coming from, but in Singapore, we do have a SingPass that has been quite helpful. First, we have a national registry identity system, so that helps. Yep. A physical card. We have 3.8 million actually active SingPass users. Most of them using different forms, username, passwords, but we have an app, SingPass Mobile, that is moving away from that, so it's more convenient yet balances security. That's about 1.1 million users at the moment. So that's, I mean, it's been a good sort of foundation to roll out stuff when people want people to sign up for new schemes, government supports and all that. Actually, it's fairly easy. Almost everybody has accounts.
Okay, fantastic. Anybody else on the panel would like to field that question? So it's about digital identity, especially in times of crisis. All right, so let's go to the next question. Okay, this is a good one. About organizing quickly, internally and externally, and whether earlier experience of hackathons or perhaps learning from other countries has helped you. And I think over here that Marko, I think you were telling us that you had solutions that were implemented in 2 weeks' time. Can you tell us a bit more about that, and how did you leverage on your community and on private sector?
Yeah, actually, yeah, thank you. It has also got what we had in Finland. So we had this kind of hackathon for crisis. It was 21st of March, etc. And we were expired by Estonia hackathon, which was 1 week earlier. And we organized such in Finland, and many really concrete solutions found out of this hackathon. So it's a symptom tracking, etc., and also this kind of solutions for tracing was discussed. So this was very useful. And now this same information, we have been contacted by different countries like Spain, and also we have been talking directly with Sweden and Norwegian colleagues about this, and information sharing has been really open. So there has been no barriers of sharing the good knowledges or good experiences so far. So we see that this has been really like working well. Thanks for everyone for that.
Excellent. Thank you, Marko. And Ingi from Iceland. So I think you also mentioned deploying volunteers to help you with the coding and the programming. And that was how you managed to get your solution out quickly, and to keep that constant iterating, constant testing. Can you tell us a bit more about that?
Yeah, the initiative actually to make the app came from the public sector. So we had a pitch from a CEO of one of the companies here in Iceland that actually told us about the Singapore solution, and said that this was something that we might be able to do here. And so he sent a shout out to other companies that could help make the app. And so we came on board, the government came on board maybe even 24 hours after they started building the app. So I was actually in charge of governing the development and making sure that all the measurement or the security measurements would be made, and taking care of privacy issues and all those things. So this was a public this was a private development in all cases, and it was also quite interesting that if we needed someone to help us with translations, or if it was something to do with publicizing or making sure the user interface was good enough for everyone who was colorblind or whatever, everyone was pitching in, and no one was asking for any money or any. Everyone was working 24/7. Sunday evenings, whatever it was, you could call anyone, and they would actually come running and helping you with everything they could. So this has been quite enlightening for us to do. And so it took, and also getting the source code from the other countries also helps a lot. So it's not just internally inside the country, the cooperation has been good, but also with other countries.
Fantastic. Thank you, Amy. Anyone else like to fill that question? Otherwise, I'm going to move on to the next one. Yes, go ahead, Chee.
Maybe Chee. Yeah.
Yes,
I just want to say that actually I think it's related to one of the subsequent questions about digital government. I think the reason why we have managed to respond fairly quickly with some of the digital areas is fortunate that we have built up some in-house capabilities over the last 4 or 5 years. We have teams of people who have been programming day in, day out. We have built components that they can just quickly leverage on to build new apps and websites. So I think that has been quite an investment that's paid off. But that's not enough. We also have been engaging quite a lot of volunteers, particularly overseas Singaporeans. Many of them are actually coming home this period, and they may not be have regular work to do, so they're quite happy volunteers who have been doing that. But maybe just one sort of caution is that COVID is not a digital problem on its own. Actually, digital tools can solve some of it, but it's not going to solve, well, like all of us being stuck at home or stay home, because that's not a digital problem. Yeah.
Okay, thank you, Chee. All right, and I do have a question about hackathons, and I do know that Sweden, there were a couple of national and international hackathons that you did. So the question here is about the winning ideas from hackathons. Normally there are not very many of them, and what happens to all the good ideas that do not win? And I also like to add on my own question, where what are your next steps for the hackathons that have already been organized so far around this crisis?
Okay, the winners from the Hack the Crisis Sweden initiative are now being implemented by the Government Agency of Digitalization, DIG, in Sweden. And they are working hard on this, I know. So within a couple of weeks, they should be up and running. They are talking to different stakeholders in the public sector to do this. But yes, correctly, there were, I think, over 530 submissions, great ideas, of course, solutions in the Hack the Crisis Sweden. And all of them are published on our website, hackthecrisis.se, and all our partner organizations, 160 of them, have been encouraged to contact them and go through these 530. Of course, they are very many, but they are clustered in different groups: save lives, save communities, save businesses. And we put a special focus on the 60 best. Those are also pushed more. So yes, of course, it's a challenge to make all of them come true, and maybe that is not the main focus. We should take the best ones, but of course not lose anything. And that's why it's also important to lift up the ones that, both the ones that won, but also all the ones that participated in Hack the Crisis Sweden. We are encouraged to participate in the EU versus virus hackathon. So we lift them up to a EU level. And I also want to point out that there were 91 countries represented within the 7,400 hackers that participated. And that was also a good example of international cooperation. And I also believe that right now there is more of a incentive from all of society to make the solutions from the hackathons come to life more than just two months ago.
Okay, fantastic. Thank you, Ann. And I also do have another angle that I was hoping to explore in this panel discussion, and it's quite closely related to this other question. So the question is, do you believe that governments that are more mature in terms of digital government transformation were a bit more well prepared to tackle the challenges posed by COVID-19? I'd like to add on to that as well. So the UNDP Global Center Singapore does a lot of work in the developing world, and our work is all about transferring technology to build smart cities in emerging economies. For instance, could you share maybe one tip that you have learned that could maybe be useful to the developing world? And this goes out to all the panelists here. Maybe we start with you, Arild, if you have anything to add on to that.
Yeah, well, from Norway experience, as I started with my introduction, is that we had started a program saying that we need to be able to service people where they live and where they stay in their homes. So, I mean, as probably all other countries, we have pressure on hospitals, not enough nursing homes. So care has to be given at home. So we had started programs way back from 2011 of putting services, tools, IT systems in place for that. But it has been a very slow process, and in the structure of Norway, where the municipalities who decide for themselves, it has taken a long time. But the basis had been, the motions have been in set. So it was more to speed up what is already has been started rather than to develop something from scratch new. So in that sense, I think at least those countries who had started sort of a decentralized approach to care and looking after people were in a good position. And I think that is a trend which we see in this whole seminar. How can digital solutions help? And I think that is, as long as you have a telephone access or maybe even a broadband access, then there are huge possibilities, whether you are an emerging country or industrialized or sort of more mature in the public sector type of view.
Okay, fantastic. So Arild mentioned two main things there. It's about moving care out of the hospitals and into the community. And it's also about really leveraging on mobile phones, which I do know that in countries such as Indonesia, it's completely changed how people access digital services. So anyone else on the panel would like to contribute?
Maybe I can pitch in a little bit here.
Sure.
I think having the national patient portal, for example, has been very useful during this crisis. I mean, we had a big portion of the population already using the portal, and the only thing you need actually is a mobile phone and an internet connection. And but having that as a framework and having that connected to all the healthcare institutions, hospital, clinics and all that, just allowed us to move so much faster and making new services instead of having to make a new app or new solution with authentication and all those different things you actually need to make sure are working, security and things like that. It's so having some kind of a channel, some kind of a portal or a healthcare network or something like that as a basic structure for having and building on that. And also having that as an open architecture, so you can have new companies coming in, making new solutions, but building on existing platforms. So they don't have to invent everything when they're starting a new app development or a new website or new service or anything, something like that. So,
are you speaking about a national electronic medical record system?
No, we actually have a healthcare network. So it's connecting all the facilities together, and that allows us to have a national patient portal also that I can actually connect with all the clinics, all the hospitals, without having to invent the wheel in every case.
Okay, fantastic. Thank you, Ingi. Anyone else would like to answer? If not, we're going to move on to the next one. Okay, so I had a few other questions from the audience, but I also do have questions of my own that I really wanted to ask. So for instance, I think we have quite a diverse panelists from different countries on this panel right now, and there was a lot of talk about international knowledge sharing in the panel earlier. And Marko, I do know that you had implemented some sort of a tracing system. I would really like to hear a bit more about it. And do you think that there could be one system that can be used internationally so that you can share data, especially since it's an international problem that crosses borders?
Yep, thank you. How would I start? So this is there's a certain challenges what we need to overcome, and one is of course that this is many times related to each country's own data policies and legislation. So this kind of if we have a virus tracing mechanism to help us to kind of get back to the work, we need to kind of deal with data protection laws and how to track that information. It's really sensitive data that has to be taken care of anonymously. So how to prepare this kind of mechanism internationally? So we can have a minimum common nominator solution that can be used for a higher level, and then develop like that further for the next wave, so to speak. But at least we should have that idea that this is not a one nation problem. We cannot solve this nation by nation. We need to cooperate and find a solution that is acceptable for all of the countries. EU has done a lot of work now in terms of making a recommendation and toolbox for this data protection recommendations, and there seems to be a way forward so that we have an EU level of solution possibly available. And what comes to your question that do we have a solution ready? So we basically have been following up all these like recommendations from EU and all the players who have been solving this problem, like from Singapore and Germany, Switzerland and Norwegian. We have been very closely following up and discussing with these developers and finding the minimum common denominator, what could be accepted by like internationally. So this is a challenge. We need to really work hard for that. And as mentioned, that code is available and ready. And 2 weeks time to be implemented.
Fantastic. All right. Thank you very much, Marko. So yeah, I mean, I do agree that all the data regulations and so on, that's definitely a bit of a knotty topic. Does anyone want to jump in on that? Sharing data with each other and how that could work. Has anyone actually cracked it even? No? Okay. All right. Well, I do have a related question for you, Chee. You mentioned a little bit earlier that countries do really need to know how to collect very clean data from the get-go. If not, you know, you might have to start over, or you know, it's just going to be very difficult for everyone involved. Do you have any tips or ideas on how you can do that really quickly and cleanly, that even people in the developing world can, you know, that's something very basic that everyone should know, and you don't really need a fancy system to do it? Yeah.
I don't have a good answer. I wish we were better at it also. I think what we have seen work quite well is to make sure the technology people as well and the people doing the contact tracing teams, the health teams in the health authorities are actually all seated together. They are all part of the same team. So if you try to keep it too separate, I think that's generally not that great. That's something we have learned actually over the last couple of years, that you really need to integrate the data aspects with the business aspects. And this is not a technologist thing. You cannot just have an IT department that tries to solve it. It needs to be a leadership call, and the people right at the very top in Singapore, in our case, you know, many of our ministers, including Prime Minister, pays a lot of attention to the data and digital issues. So that's been a lot of emphasis there. Yeah.
Okay, I'm glad you mentioned that, because I did want to ask about leadership when it comes to digital and data. You know, like Chee mentioned, it comes directly from the Prime Minister's office, and I'm wondering if is that the same for everyone else on the panel?
Our leadership comes from the Ministry of Health in Iceland, but of course during this crisis we have had a huge backup from all other ministries for foreign affairs, getting us access to other countries, and the Prime Minister and everyone is involved in this.
Okay, fantastic. Okay, before we go on, I know it's supposed to be ending the session pretty soon, but I see that there are a couple more questions coming in. Does anyone really need to go? And if so, we will end it now. If not, maybe we'll just overrun slightly by a couple more minutes. Is that okay with everybody? Okay, great. All right,
yes,
so
okay.
Perfect. Okay, a couple more questions coming in from the crowd. Let me see. Okay, so there is one from Benjamin Welby. What is the strength of the Nordics, other than digital maturity, to tackle COVID-19 with digital solutions? So our friends from the Nordic countries, would you like to jump in on that?
I can start with I think we are I mean, population-wise, we are not big countries.
Absolutely.
So that's one aspect of it, and I think we are a fairly homogeneous society. The spread in society, so to speak, is not that big in the Nordics as it may be in other, in terms of education, money, poverty levels. So I think we are fairly on equal basis in the Nordic countries. The social democratic model is strong in that. So I think that is, I think, in crisis times, that is a strength, and trust in government. I think all Nordic countries has a huge trust in government. So when they say something, we follow it.
Fantastic. And what about you?
Yes, I totally agree about the trust in authorities. I think is greater in the Nordic countries than in many others. That we trust our authorities and we do what they tell us to do as a population. And also, I would like to add that the Nordic countries, the population is quick to try new digital tools. That we are faster than many other populations to try out and accept new tools. And in this context, of course, that is imperative.
Fantastic. Ingi and Marko?
Do you want to start, Marko?
Please go ahead.
Okay. One of the things I would want to mention also is, I mean, the trust level here is, there was a recent survey saying that 96% of the population trust the government to handle the COVID crisis. So that's, I think, the highest we have seen. And but I think the key issue there is actually, it's not the politicians that are actually handling it. It's the doctors and the people that actually know how to handle this, and the politicians, they don't really interfere. Of course, they support them, and but they don't fire them if they don't like their answers or things like that. That's like we have seen in some countries.
Sure. Absolutely. And you, Marko?
Yes, definitely sharing your views, Arild and Ingi. So, and I think one element to add here is that in Nordic countries we have a low hierarchy, low barriers to start talking about issues. So if we have an issue, so it's a common issue very quickly, and people are willing to help. And there's a special words. I think that they, especially like in Finland and in Sweden, we're having a word for making something together, like for free. So if your friend or neighbor is building a house, so people gather together and make the house together, and just like helping each other. I think this kind of willingness to help is one element, especially here what I sense.
Fantastic. All right. Okay, maybe just a couple more questions. And I do think that also, well, okay, let me see. Sorry, there were a couple other questions that just came in. Okay, maybe I'll just focus on the audience questions actually. There is a question here about, could a long-term solution to prevent a future pandemic from spreading this quickly and this widely be to reverse the trend of moving to big cities, especially where we are all very densely packed in. And you know, I think for a lot of people that's a bit unavoidable, but I'm wondering what are your thoughts? And this is a question to the entire panel, thinking about, you know, the urban and the rural divide especially.
Okay, maybe I start this from Finland. So I'm coming from countryside myself, and I feel that it has a lot of values to be there, and I see this as an excellent possibility now to when remote working and less commuting is becoming a trend, hopefully. So we can enjoy the countryside living and move back to some rural areas instead of packing ourselves in big cities. So I think this would be a good idea and good development.
I think perhaps in practice, maybe slightly a bit harder for perhaps, you know, I come from Singapore and Singapore is very densely populated. I wonder if anyone has any thoughts on, you know, okay, for instance, right now we are midway through our circuit breaker measures, which is like a partial lockdown. And, you know, everyone is sheltering at home. I guess that's one short-term solution. Just wondering if there are other long-term solutions for big urban cities.
I actually think that the using a tracing app with the Bluetooth technology can actually help a lot in dense population, and so it's and I think it's going to be vital here in Iceland when we are changing the rules for our partial lockdown in 2 weeks' time, and people are worried that things are going out of hand, and people are thinking about how is the sports going to develop this summer, and all those different things. So I think that having an app with a good spread among the public can actually help contain small outbreaks much quicker than we could without having apps like that. So this is the reason we are actually focusing, even though our numbers are going down quite fast now, and we are going down to maybe 2 infections a day or 4 infections a day now. We are not slowing down on the development of the app, because we know it's going to be vital to have the app to be able to actually gather the people into quarantine that actually came to close contact with an infected person without having to go down to lockdown for everything again.
Sure. Okay. Thank you, Amy. Anne, you wanted to answer? Yes.
Yes, one of the winners from Hack the Crisis Sweden actually really has a very interesting solution called Corona Free, and that is an app that aims to track not those who have corona, but those who have had it and become immune. So it would be like you can go to a doctor and have a quick test that shows that you are immune, and then after that you can go back to society with this immunity certificate in your mobile phone, and that would aid society in getting on track again. And that is one solution that will be in the EU hackathon this weekend as well, because of course we need unity in the solutions that we use for immunity over the EU.
What about privacy concerns around tracking people? And this is also a question to everyone on the panel, because I think all countries are trying some sort of tracing, community tracing in one way or another. Marko, do you look like you'd like to share? Yeah, go for it.
Okay, thank you. So we are quite deep in this, and we know that this is definitely an issue of legislation, and we need to follow that. So and there are solutions that we can really do it with data protection laws, kind of compatibility, and also this is very important to communicate people that people are not traced. So this is point is that the understanding the solution is not tracing people, but there's really a intelligent mechanism to trace the virus and potential infections, and this is a matter of communication, and not just like and the solution is kind of following the regulation and following the law, and the idea is really that we use technology to actually be compatible.
Okay. Yes, Chee, please go ahead.
Yeah, I thought that maybe I'll just say very briefly that I think we are thinking through what are some of the measures that might be needed in order for us to be more comfortable lifting the sort of circuit breaker measures or enhanced circuit breaker measures, because you do want to have the confidence, not just that when the infection, the number, the community spread has gone down, but actually that we have sort of the measures in place or the tools in place to be able to quickly detect, isolate, and then keep it that way. You know, you don't want that to have a resurgence.
Sure.
I think also, you know, some of the panelists also talked quite a bit about tracing, but I want to just make a distinction between tracing and tracking.
Okay.
Yeah, because tracking is a lot more scary. Tracing sort of, you know, how Trace Together and some of the tracing apps, basically they might know which devices have been near you. They have no idea where you are. And I think that's a very important distinction to make so far. I mean, it's obviously in terms of effectiveness, at some point maybe you do need to complement it with location. But even then, you want to be very clear, like, you know, what stays on the device, when is it uploaded, do you collect only when necessary, and so on. Yeah.
Okay. I'm sure everyone's been asked that question a lot. Okay, so I see that there are other questions, but I think we've overrun by a fair bit. So I'm just gonna end off the session with just one last question, and don't worry, this is an easy one. To all my panelists. So I think we're all, stuck at home, and we're all in this together. How are you coping with working from home? So for me, I have been keeping a journal every day, and I call it like my pandemic journal. It's really just like little voice notes to myself every day, just to keep myself sane, just to talk about like how frustrated I am, but it's really helping me. Yeah, so what are you guys doing? Are you on Netflix? Are you on a house party? Go for it. Who'd like to start? Ingi, yes.
Yeah, I can start. Actually, it's been so busy for the last few weeks here. I've been working from my basement, and my kids and my wife are upstairs. So I've been working probably 14, 16 hours every day. So I haven't been able to think about it that much. I've been just doing things. So that's one way to cope with things. I don't really, sometimes for days, I don't know how many infections we have or anything. I'm just too busy doing the work and coordinating the efforts. So sometimes I'm just, so that's one way to cope with things.
All right. Lots and lots of work. Okay, that's one.
yeah, that's one.
Okay, what about you, Ann?
I live in the countryside in the south of Sweden.
Nice.
So every other week I used to be in Stockholm working, but I am actually used to working from home every other week. So this is more like of a transition to working from home every week and not just every other week. So for me, the transition hasn't been so big. I'm used to having video meetings every other week, all day. So yeah, I think I felt this more a couple of years ago when I started working like this. Yeah, right. So okay. Yeah, I can agree with Ingi. Just working and not keeping up with how many are infected and so forth. And then you turn on the news and you go, oh, and you can't be out of the loop for 24 hours nowadays because everything is moving so fast. So absolutely. Yeah, just working. Yep.
All right. What about everyone else?
Yeah, I can. For my part, like Ingi, I run a health cluster with 190 members and working in this space, so that it has been booming. Where a lot of companies have a lot of good traction, so it's been a lot of work. And then when you go off Teams in the afternoon, non-stop Teams working or Zoom, then go out and enjoy some really nice spring that is in Norway now.
Really important. Yes, yes. Marko and Chee, what about you guys?
I can
maybe
go. Go ahead, Marko.
Oh, I think, okay, Marko, you go.
Okay, thank you. So this has been an excellent experience. Without this kind of crisis, we wouldn't have taken this kind of remote working into kind of seriously, and it works amazingly good. Also, all these technologies are actually proven so good at the moment. So I think we should continue this definitely. And I think this is an excellent impact to the nature, and we have been talking about the other crisis, so it's global warming, and due to the carbon dioxide. And I think because of less commuting and business traveling, I think this is also an improvement. So I think we are luckily seeing some good results out of this if we keep this kind of trend, what we have now developed.
All right, last but not least, Chee, how? Is it like a one long Zoom call the whole day?
Yeah, no, it's back to back. Like we have Skype within government, so it's back to back calls. I think it's actually quite interesting to do sort of working from home, more people telecommuting, but having kids at home complicates the picture.
I can imagine. How are you dealing with that?
I have some help at home, so that's not too bad. But they do come in and disturb from time to time. I think maybe just keeping sane. We are trying to learn this as a whole organization, not just individually. But how do we do a lot more social engagements? My team have virtual lunches. We are having to do a lot more now. There's no more in-person meetings. A lot more like virtual town halls, or just see each other. You know, turning on the. You don't always turn on the video when you do video conferencing. Sometimes people just turn off their cameras, but once in a while we try to get people to see each other. Yeah, and maybe the other point is still take breaks. Yeah, that's good. Walk around.
Get some fresh air. Get some sunshine, some vitamin D. Alrighty. Thanks so much, everyone on the panel, for your time. Sorry that it overrun a little bit. And I do see that there's still other questions in the Q&A. So let me see if I can get some individual responses from our panelists over email or something like that and get it out to the participants. Thank you so much once again to Arild, Ingi, An, Marko, and Chee for your time. Lastly, can you all just wave to the yes, I'm just going to take a really quick screenshot. Yes, very nice. Thank you so much. All right, goodbye everyone. Have a wonderful day ahead. And Chee, have a really good evening. Since we're in the evening here almost. Thank you guys. Bye.
Thank you. Thank you. Bye-bye.
Thanks for joining. Bye.
Thanks very much. Bye-bye.
Thank you. Bye.